Structured and standardized clinical handover when transferring patient care between healthcare providers or location. In this presentation, we will discuss the importance of structured and standardized clinical handovers, what are the risks of adverse events, and workplace safety caused by deficient handovers, factors why deficient handovers are occurred, systemic implements about clinical handovers, and how leadership can support clinical handovers. This PowerPoint is designed to capture audience attention through bullet points, color, font, size, images, and animation. The information is arranged in an understandable order, providing a multimedia stimulus to achieve better engagement to the presentation. What is clinical handover? Clinical handover is an intervention that provides the occasion for the incoming and outgoing nurses to communicate about the patient effectively. The Quality in Australia Healthcare Study in 1995 revealed that medical errors and adverse events happen on 16.6% of the hospital admission, roughly 18,000 caused death and around 50,000 resulted in permanent disabilities. Research has identified multiple deficiencies in shift-to-shift handovers, and communication error contributed roughly 51% of the adverse effects. Clinical handover is a high-risk procedure for patient safety due to the potential for communicational error. A research conducted in the clinical study of emergency department handover revealed 15.4% of cases fail to transfer adequate information end up as adverse events. Firstly, handover is a very frequent procedure in healthcare. It is performed when there is a change in patient's clinician or shift change, when patient is transferred to a different location, ward, facility or service, when the patient care is brought up by the multidisciplinary team or structured interdisciplinary bedside rounds, transferred for a medical appointment or test, or when the patient is discharged. Factors such as handover format, safety climate, relationships, interruptions, fatigue, job stress, and staff affects the quality of handover. Multiple international studies reveal that clearly defined handover policies enforcement are lacking and clinicians' practices fall short on the guidelines. Also, cutting corners inhibit effective communication, which leads to preventable adverse events through shortcuts, errors, workarounds, and violations. Cutting corners is common practice in healthcare. It contributes to avoidable errors, delays in providing care, and complete or partial omission of care. In addition, surveys revealed that the time to conduct handover, the subjectivity of handover, handing over of information from a clinician that has not cared for the patient, and repetition of information that can be found in the patient's file or care plan contributes to poor practice. What is currently being done about the problem? As a new graduate nurse, they should understand poor handover practice can increase patients' risk. Handover should be an interactive exchange of information. Nurses should advocate for the patient's safety and clarify all the information with active listening skills. Bedside handover with the input of patient and their family should be encouraged. Not only it will improve the clinician-patient relationship, but also better patient-centered care. Besides, new graduate nurses should have the courage to speak up and ask anything that is unclear and unsure in the handover. Nurses should provide backup and support for any missed information. This practice can minimize the risk of communication error and better workplace safety. Nevertheless, new grad nurses should take the initiative to follow the standard for practice, complying with legislation, regulations, policies, and guidelines. Moreover, develop practice through reflection on experience and knowledge to achieve better practice. Policies within New South Wales Health were implemented according to the National Safety and Quality Health Service Standards, Standard 6. Clear directives were given to guide the structure and process for safe clinical handover. They include patient, family, carer involvement, leadership, handover participants, handover time, handover place, handover process, and documentation. New South Wales Health have also enforced business rules around safe clinical handover, which include more specific details and tools to further guide healthcare workers and clinicians the structure and process, such as communication script, patient identification, key interface, staff education, and consumer participation. Handover should be supervised and chaired by a person in charge of the oncoming shift. It should be conducted in an environment that is safe with less distraction, ensure compliance with the business rule and policy. The bedside handover has proved being able to reduce the risk with an opportunity for patients and their family input and clinicians checking on their patient, infusion device, and the relevant monitoring equipment. Under the policy and business rule, clinicians are required to use the ISPA format to prioritize information when communication about a patient and their condition. ISPA is an acronym for Introduction, Situation, Background, Assessment, and Recommendation. As a new graduate nurse, we should utilize the standardized mechanical tools to organize and anticipate all information required for a handover. Nevertheless, persistent complying with the legislation, regulation, policies, and guidelines. Moreover, develop practice through reflection on experience and knowledge to achieve better practice. Nurses are obliged to ensure that they are practicing the most up-to-date policies, which is part of their scope of practice. Education and training. All clinicians employed by the New South Wales Health and students who are having work placements within a New South Wales Health facility are required to complete the clinical handover component in My Health Learning, designed by Health Education and Training Institute of New South Wales. As a new graduate nurse, we should actively engage with staff education by enrolling into online modules and workshops, as the learning increases the knowledge, competence, and confidence in providing and receiving clinical handovers. Firstly, clinicians spend extensive time to retrieve relevant and correct information from other sources, therefore increase the possibility of poor use or misuse of resources such as work time or tests and inappropriate care. Poor quality handover cause ineffective communication, which can lead to medical errors, hinder clinical and non-clinical productivity, increase workplace conflict, poor decision making in both clinicians and patients, and stress. What is leadership? Leadership is the ability to interactive, influence, and be committed to a common goal. Studies have shown effective leadership is beneficial to the team, staff retention, but also the clinical outcome. Resilient relates to an individual's capacity to continue to be positive, thrive, and function against adversity and difficult circumstances. Sociocultural influences human behavior such as individualization, self-control, and autonomy. Policies focused on individual level intervention are found more effective. Clinical supervisors promote clinical staff well-being by provision of support. They ensure the delivery of high-quality patient-centered care through accountable clinical practice and decision-making. As a new graduate nurse, we should utilize the resources provided by the organization to improve our ability to practice all seven nursing standards. Nurses should take the initiative to engage in therapeutic and professional relationship through resilience and better understanding of social cultural influence. Avoid behavior that may be seen as bullying or harassment and or cultural unsafe. Engaging with clinical supervisors and educators would refine our quality of care through supervision, coordination, and consultation. Policies are a response to an increase in awareness of an issue. In 2017, World Health Organization has launched the 9 patient safety solutions. One of the solutions was specifically about communication during patient's handover. In 2008, the Garling report recommended a system-wide improvement in clinical handover policies in New South Wales health facilities. Australian Commission on Safety and Quality in Healthcare introduced the Aussie Guide to Clinical Handover Improvement and the National Safety and Quality Health Service Standards, which involved clear guidelines and standards for clinicians and healthcare workers to perform safe handover practices. Nursing science and research finding are powerful ingredients in influencing healthcare policymakers. The Garling report, based on the science and research findings, outlined clinical handover can influence patient and workplace safety. Standardized training, communication, and verbal handover structure has been shown to improve the accuracy of critical information being transferred or acted on. Policy, protocol, standards, checklists alone will not prevent all communicational error. Studies have shown that incidents were commonly the result of multiple small errors happening in a fundamental systemic environment. According to Swiss cheese model, each layer of cheese represents a layer of precaution. The more layers of cheese, the less chances the holes on the cheese will line up and cause error. All nurses are leaders. We are trained to be competent and compliant to policies and procedures of clinical handover, advocate and speak up for patients and their family, and transfer efficient clinical information to other healthcare workers. We are also a role model and strive to be liked in the workplace through building resilience. We are passionate about continued learning as knowledge builds confidence and competence.